As Texas students return to the classroom, many are at risk of not getting the mental health help that they desperately need. Depression and suicidal thoughts, especially among teenage girls, are at an all-time high, according to the CDC. So the CBS News Texas I-Team has set out to look for solutions.
Investigative reporter Brian New is joining us from Plano now. Brian, we know there is no simple fix for this.
There's not, Ken, but something needs to be done. According to Mental Health America, 3 out of every 4 Texas children with depression don't receive any mental health treatment. And so as we went around the state looking for solutions, mental health professionals told us perhaps the best place to start is in our schools.
When Dylan Crow is stressed, anxious, depressed, these days he finds comfort in writing about it. But that wasn't always the case. For Crow, his struggles with mental health started when he was 15, a freshman in high school.
I started feeling depressed and suicidal.
At the time, he also started having hallucinations.
I was scared because it wouldn't go away, and I felt like I couldn't move, like I was having sleep paralysis or something.
Crow was eventually diagnosed with schizoaffective disorder, a mental condition with symptoms of bipolar disorder and schizophrenia. Over the course of the next 5 years, Crow went to 4 different high schools, with long stretches in between at mental health facilities. Crow says every time he went to a new school, there wasn't the help he needed.
They tried to have the resources, but there's just so many kids. I know this sounds really hard to do, maybe I'm wrong, but maybe they could hire more counselors.
According to the American School Counselors Association, for every 10,000 students, there needs to be 40 counselors. In Texas schools, there's 25. The National Association of School Psychologists says for every 10,000 students, there needs to be 20 school psychologists. In Texas schools, there's less than 4. Outside of school, finding mental health help in Texas is often just as difficult. 80% of Texas counties are designated as mental health professional shortage areas.
So I don't know if we're ever going to get to where we don't have any mental health shortage.
Dr. David Lakey is the head of the state's Child Mental Health Consortium. He says one way the state is trying to make sure all students get the mental health help they need is by offering telehealth services. The program is called T-Chat. It is now in more than 600 school districts across the state and has been used by more than 20,000 students, many who otherwise might not have had any access to mental health services.
The standard waiting period to get into a child and adolescent psychiatrist in the state of Texas, is about 6 months, and we're able to get these services to kids right away.
But despite the state offering this program for free to Texas schools, not every school district has signed up for it.
There are still nearly 400 school districts in Texas that have not enrolled in T-Chat. Why is that?
I think it's the natural growth of this program. Again, I would remind us that the first kids that were seen in T-Chat were in the spring of 2020. And so we're just 3 years into this program.
Are you concerned about those districts?
Yes. Yeah, we're concerned about those.
But even in districts that have enrolled in the T-Chat program, school officials say this program alone won't solve all the issues with the mental health professional shortage. And so some schools are thinking outside the box. Here in the rural district of Sanger ISD, school officials are turning to students to help each other.
I think a lot of students have lost the capacity, or maybe are not learning it, to resolve smaller situations.
Ann Hughes has been the director of student behavior in Sanger ISD for 23 years, and every year she looks for new ways to improve students' mental health. One year she started a student-run free grocery store. Another year she turned a traditional classroom into a stress-reducing movement room. This year she's starting a teen court program at the high school and a peer-to-peer mediation program at the middle school. Hughes says these new programs will teach students to resolve minor problems themselves and thus free up the school's limited mental health professionals.
Having those programs really opens the door for counselors to be able to spend a lot more time with the more involved students who really need professional guidance and professional support.
Sanger ISD has a track record of success when it comes to mental health. Just ask Dylan Crow.
I'm so grateful for the teachers and everybody who've pushed me.
When Crow enrolled at Linda Tutt High School in Sanger, his 5th high school in as many years, he says he finally found the support he needed. The school even has a designated room known as the chill room, where he goes to calm down and refocus. Crow is on track to graduate in the spring, and for the first time in years, he says he's happy.
Where would you be without the school?
Can I be like really honest?
Honest.
Honestly, without the school, I don't think I would be alive.
We have to do what we can with what we have. That's just the reality of any profession. And then try to find ways that are creative and innovative to meet the gaps.
Now, with every program that Sanger ISD has used over the years to try to address students' mental health, Ann Hughes says she has been intentional with tracking whether the program is working using data. Karen Hughes says that unless you track using data student performance and behavior, it's really hard to tell whether a program is truly working.
And Brian, we know that no program alone is going to solve this issue, right? But ultimately, a large part of addressing the shortage of mental health professionals has to be by expanding the workforce. Is the state doing anything to directly address that?
Yeah, so the state is really taking two approaches to that, Karen. One, they are creating more training opportunities, and the other approach is that they are expanding student loan forgiveness program. The idea is to encourage more people to go into those professions, but Karen, neither of those are quick fixes.
Brian, the T-Chat program, obviously it sounds to be a good option, but did you get a sense of why some school districts still have not signed up for it?
Yeah, Ken, there's not a single reason why school districts have not signed up for it. Some told us that they simply felt like they had enough mental health resources for their students. Others told Dr. Lakey that they're going to see how the program works in other school districts before they decide to sign up.
All right, Brian, you live for us in Dallas tonight. Thank you so much for that information. Great work, as always, Brian.
If you or someone you know is in need of any kind of mental health support, you can call or text the National Suicide Prevention Lifeline at 988 or chat online with a counselor at 988lifeline.org.